A woman came into the pharmacy the other day and said something that unfortunately I hear all the time. She said, Steve, I just don't feel like myself anymore. It's not that I'm depressed. I'm not sick. I'm not lazy, but it's just so hard to show up. I'm taking care of my family. I'm doing all my duties. I'm working my job. But unfortunately, I just don't feel the way I used to. I feel off. Her sleep wasn't right. Her mood was a challenge. She struggled with brain issues. She gained weight in areas that she just didn't understand why. And just life had become unpredictable, which before it always seemed kind of simple. And the part that scared her the most, the quiet saying was, my personality has honestly just shifted. She looked at me and asked, am I getting older or is something really wrong? And to be honest with you, that's what this podcast episode is all about. Because for a lot of ladies, this feeling isn't psychological, it isn't weakness, and honestly, it's not just aging, it's actually estrogen. It's this change in estrogen that happens in the body that honestly, most women are just never taught about and just don't understand. Estrogen, it isn't just periods and pregnancy, it is the body's master signal. It controls things like your brain, your heart, your bones, mood, metabolism, and even how you feel inside your own body. Because when the estrogen signaling changes, it isn't just one of these things that happens overnight, it's gradual. Or it can happen suddenly during a hysterectomy, or it can shift dramatically during menopause. So this doesn't just affect one thing, it affects the whole entire body. And once a woman understands this, realizing these symptoms aren't just random, it all starts making sense. So let's dive into the truth about how estrogen affects the body and hang it at the end because I got 20 years of questions that I've been asked that I'm going to clear up and give you the answers that you've been looking for. So what does estrogen really do? Estrogen plays a role in about 400 processes in the body. And your body really makes three main estrogens. And these estrogens are important for you. And your ovaries are the main organ that makes estrogen before menopause. Now, during pregnancy, it's that placenta that can actually make estrogen. But here's the real challenge. As you get later in life, and the ovaries aren't making estrogen, your body relies on other things to make a little bit of estrogen, but that can have a big impact. Things like fat tissue, your adrenal glands, and even bone and blood vessels and the brain can make small amounts of estrogen. But at this point in life, estrogen levels drop dramatically, and you can see the difference when these estrogen levels fall. Estrogen, it's not just a female sex hormone. It really is a master messenger that has effects on all parts of the body, like the brain, the heart, bones, immune system, skin, and even the gut. And a lot of reviews show actually that estrogen is a master messenger that keeps homeostasis in the body. There are three main forms. The first one is estradiol. This is the main powerhouse estrogen that works. That's the main one prior to menopause. Then you have estrone, which is more of an inflammatory estrogen that shows up more postmenopausal later in life. And then you have this other estrogen called E3 or estriol, which is more apt to show up during pregnancy, but it's a unique estrogen in that it has the ability to bind a certain type of estrogen receptor called estrogen receptor beta that actually has some anti-inflammatory to modulate the immune system and actually provide benefit there. You have estrogen receptors all throughout your body, and the two main ones are estrogen alpha and estrogen beta. And keep in mind, these are found in things like your blood vessels, bones, the hippocampus, and other brain areas, fat tissue, and even in the vaginal and urinary tract. So now that you understand when these estrogen levels fall and don't affect these estrogen receptors, that's when you start seeing all these crazy things that happen all throughout the body because these estrogen receptors are everywhere. On a past podcast, one of my guests called estrogen like a Wi-Fi router. And this is what I mean. When the signal's strong, everything's coordinated, everything looks good. But when we get a bad signal, estrogen levels fall, things aren't connected anymore. They fall apart. Signaling is weak. And guess what? The whole connection and your connection within your body begins to fall apart. And that's when these symptoms and issues start to show up. So when you're told that estrogen only really matters for periods and pregnancy, I think you kind of understand now, whether it be your brain, vascular health, bone, estrogen is super important. And you have to look with many women living 30, 40, 50 years after menopause, having good quality estrogen is key. And we're going to talk about more about replacing it, but I think you can see the power that estrogen has, especially in those post-menopausal years, those years after your last period, to make sure estrogen maintains so many critical systems in the body and keeps everything working and connected. So let's break down estrogen in certain parts of the body, and let's start with the brain and mood. Estrogen boosts the serotonin production in the brain by actually controlling enzymes that actually help the body make tryptophan into serotonin. but it also works on preventing the breakdown of this serotonin. In addition, serotonin can actually regulate the serotonin transporters and receptors, and this actually then influences things like dopamine and glutamate. And so keep in mind, it's this ability of estrogen to actually turn the knob on things like emotional regulation, pain perception, and cognitive speed that makes estrogen so powerful in the brain. One study shows that during this menopausal transition time where the estrogen levels begin to fluctuate, it can coincide to up to a 14-fold increase in the risk of depression. And this is because not just because the levels are low, but it's the fluctuation of estrogen that can cause these issues and is a major driver of depression in women. And sadly, I see many women given things like SSRIs for hot flashes and mood without really being told it's this fluctuation of either low estrogen or high estrogen that can happen during these transition years that really is an upstream that's affecting serotonin, which is ultimately causing the initial problem in the beginning. But I think some of the science is starting to come around that many menopause reviews and psychiatric evaluations are starting to consider hormone replacement instead of just throwing an SSRI at the problem. So when a woman has slowly decreased in estrogen levels, low estrogen, this may explain why the importance of the brain that estrogen has when somebody says, I just don't feel the way I used to, because estrogen is powerful in the brain. And one last thing is if you're throwing an SSRI and it really didn't help much, it's probably because the estrogen isn't allowing the serotonin to be as effective. And we really need to look at that root cause issue, which is making our estrogen adequate and controlled to help control and solve this problem. So let's talk about estrogen in terms of metabolism, heart, and bones. Because when estrogen levels fall, women often see that central fat begin to happen, higher insulin resistance. We start seeing those cholesterol panels change in an unfavorable way, and we can even see endothelial dysfunction. And there are many cardiology statements now stating that they know that menopause-related estrogen loss is an established cause of cardiovascular endothelial dysfunction. There are now randomized trials and cohort data that shows that when hormone replacement is given to women in the form of estrogen, especially initiated in those younger years, more than, like he said, that 50 to 60 year range, and given within that 10 years after menopause, we actually can see there's a decreased risk of myocardial infarction and actually cardiovascular death compared to those that started later. So it's important to see that direct connection with estrogen in terms of preventing cardiovascular issues. Estrogen is a major driver of bone remodeling and maintaining and restoring that bone resorption. And what we see even in women who have premature ovarian failure, that means they stop making estrogen before they should, they actually have a greater incidence of not only fractures, but osteoporosis. And this is directly related to that estrogen decline that happens during this condition. Because we know we can improve the bone ability to heal and grow with estrogen replacement. And there's a brand new 2025 study out in Lancet that actually shows that when we discontinue our estrogen replacement, we see a steep rise in the fracture risk over time. And this is directly related to that fracture incidence climbs more sharply after the therapy is stopped, especially as patients get older and older. So estrogen is so critical in terms of keeping your bones healthy, because unfortunately, if we break a bone or break a hip later in life, it really sets us up for a decreased quality of life, but more importantly, it dramatically increases your risk of death. So in terms of estrogen, if you think of estrogen keeping their arteries like flexible like a water hose and not stiff and cracked, but also more importantly, if you're starting to see those things midlife where all of a sudden your cholesterol changes, your blood pressure changes, you're starting to put on that waist in the midline, you have to start thinking about estrogen because it plays such a huge role here. So let's talk about the estrogen part really nobody wants to talk about, but maybe the secret that everybody needs to understand, and that is estrogen is key for that genitourinary and sexual health, because estrogen maintains the thickness, the elasticity, lubrication, and blood flow of the vagina and lower urinary tract. And when levels fall, many women experience some of the most disappointing and really debilitating symptoms that occur with menopause, and that's vaginal dryness, pain with intercourse, and these recurrent urinary tract infections. I have worked with so many women with chronic urinary tract infections, and I can tell you one of the key things that must happen is replacing that estrogen when estrogen levels fall, because that vaginal tissue is laden full of estrogen receptors, and it's one of the first tissues to scream, hey, I don't have enough estrogen when these issues begin to show up. And one of the most exciting things as a pharmacist that I see is some of the FDA back off on some of the scary language about estrogen. And vaginal estrogen is that one place that I can say local use of estrogen vaginally is very safe. We're starting to even see prescribers that are using this for patients who have cancer in the past. Now, don't get me wrong, check with your healthcare provider before that would ever happen. But I'm starting to see it more and more because these low dose estrogen levels needed to reduce all those vaginal symptoms can actually be very beneficial there, but it doesn't increase risk. And the data showing it doesn't increase the risk of things like breast cancer, cardiovascular events, or even things like stroke, because the local effect is really what's there. We don't see much of a systemic level of hormones when they are applied vaginally in a low dose. And my last point on this is if you have chronic urinary tract infections and you're not using vaginal estrogen, that's one of the biggest things, because you have to have adequate vaginal estrogen to maintain the certain microbiome, that vaginal microbiome, and keep it healthy. And they go hand in hand. They're symbiotic. If you put back good bacteria but don't have estrogen, or if you use estrogen and don't put back good bacteria, you're going to struggle with this chronic UTI issue. But fixing that can break the cycle and can be a game changer for so many women that UTIs stop and control their daily living. So up until just recently, there's always this big fear about estrogen in terms of cancer, stroke, and dementia. And I can tell you, the flame was stroked back in the Women's Health Initiative study, where we looked at a lot of patients who were already older, not in the ideal period to take estrogen, took the wrong type of estrogens, or took it in the wrong form, or also took things like progestins and combined all this together. And all of a sudden, we saw increased risk of strokes, blood clots, dementia risk. And all of a sudden, the word got out that estrogen was horrible. But luckily, this narrative is changing. Now, I've seen this over the last 20 years, but the data is finally coming out saying that timing is what's important. And it's been confirmed in randomized trials and observational studies that when hormone therapy done the right way in the right doses, right forms, is given to women who are younger than 60 or within 10 years of menopause, this significantly reduces all-cause mortality, cardiovascular risk, whereas before we didn't think that that was really what was happening. We thought it increased risk. But even more importantly, I want to stress that this is important to look at because understanding the data, this is what I've seen for years in clinical practice, but at least now we have the studies to support this and prove this to be true. Now, keep in mind, you may say, Steve, well, what if you started after that? I think there's benefit there. There's just not as much data to say it is overwhelmingly powerful in terms of preventing the cardiovascular issues, the breast cancer issues. So I'm a believer, we'll talk about that in the FAQs, about you're really never too late to start it, but there is that magic window. So that's what's important about getting this information out there now. If you're in that magic 10-year window after menopause, or you're less than 60, hormone replacement it's in its gold age during that time. Even when it comes to brain health and dementia, I want you to know there was so much data out there showing that actually hormones could cause dementia, but I can tell you, I've done told you the power that estrogen has in the brain. So once again, it's not the end all be all that can prevent dementia, but if you look at hormones done right, the right window, the right time, the right dose, the right form, and given and monitored properly, you can dramatically decrease the risk of these major issues that affect women later in life and not actually cause them, which is what's been told for all these years wrong and has prevented so many women from benefiting from hormone replacement. One core idea to remember is that estrogen isn't inherently bad. And estrogen needs to have consistent levels to cut on and cut off pathways in the body. But this fluctuation that begins to happen late perimenopause and into menopause is what makes the body kind of go out of whack, lose that connection, and that's when the things start to show up that we typically see during menopause. Fluctuating estrogen causes receptors then to begin to shift in their sensitivity. The nervous system begins to kind of not understand what's going on, and it shows up in things like hot flashes and mood swings, sleep issues, joint pain, and even mild cardiovascular issues because the estrogen levels begin to fluctuate, not be consistent, and this creates chaos in the body. And we just talked about regular menopause. What about things like surgical menopause or even things like early menopause? And what we're finding out when these hormone levels, especially like estrogen, drop dramatically overnight, this further then drives women to have greater, higher long-term risk of like things like cardiovascular disease and fractures, more so than a lady that went through regular menopause. So you can see how powerful these hormones are in preventing issues down the road. So one core issue is, and I see this as a pharmacist, you don't just need to block symptoms with things like sleeping pills, SSRIs, pain meds. You need to restore estrogen back in that environment that makes sense for your age, your risk factors, but other things to restore that estrogen to create this normal signaling and receptors and help eliminate many of the things on the outside you see as menopausal symptoms, but more importantly, the protective effects you get on the inside of the body to make sure you have good health and even better health as you get older. So what can you do before hormone replacement therapy or things to support your body when it's starting to change to get the most out of your estrogen? First is track symptoms. Notice what's happening on. Track things like hot flashes in your sleep and your mood. And when you see these are becoming more and more out of whack, even things like joint pain, it's time to have that talk with your prescriber to look at these things and am I a candidate for estrogen replacement? And one of the biggest drivers that I would say with estrogen replacement, and keep in mind, it's really tricky to monitor estrogen during late perimenopause and menopause because your estrogen levels can bounce up and down day to day. So one day you can check your levels and your estrogen level will be low, and the next day it may be back to normal. That's what makes it so tricky, but that's what's important in terms of understanding estrogen replacement is understanding when your periods stop, tracking that time, and then knowing when to start estrogen so you get all those benefits, as I mentioned earlier. But when these estrogen levels begin to change, there are modifiable lifestyle things you can do. Like you've got to work on sleep. We've got to work on a good diet, an anti-inflammatory Mediterranean type diet, and we got to get rid of the ultra-processed food. Controlling alcohol, definitely stopping smoking, controlling stress, and trying to stay active is critical to maintain that you support what estrogen you have and allow it to work better. Keep your bone healthy, keep it strong, support vascular health by doing weight training, resistance training, making sure you're getting adequate protein, optimize that vitamin D and calcium. And these are critical to actually help prevent some of those early issues that happen when estrogen levels fall off. And finally, support your brain and brain chemistry with doing a lot of nutrient-dense foods, making sure you have adequate omega-3s, and I mean a good high-quality omega-3. And then finally, adequate B vitamins to make your neurotransmitters to keep your brain healthy during these estrogen changing times. So you've done all these things and it's time to replace estrogen. So here's what you need to know. When we do hormone estrogen replacement, we typically replace two hormones. One is estradiol. That's that powerful hormone estrogen that you made prior to menopause. And then a lot of times I recommend to also support and replace estriol. But keep in mind, hormone replacement is replacing exactly what the body made, which means if you're replacing hormones, they should match exactly what your body made. If you look at them underneath the microscope, they're the exact same chemical structure. Now, estradiol, that's called E2 sometimes, is big for that bone, heart, and brain support. But if you want to look at replacing estriol, it's like 80 times weaker than estradiol. But it not is so much to help the brains and the heart and the bones. This one has more of that effect, and I typically see it more for vaginal health. And it is also an immune modulating anti-inflammatory estrogen that pairs well with estradiol to give you that overall benefit. And a lot of times when these two are put together, estradiol E2 and estriol E3, this is something that's called biased. When it comes to estrogens, my preferred routes are topical, and that means through the skin. And those are things like creams or gels. Now, we also can do vaginal low-dose creams and gels to help with vaginal symptoms. But if we're looking for systemic overall effects, we typically look at creams, gels, sometimes patches. Those can be used, and those are the most preferred. Now, we can replace estrogen by mouth orally, but I'm about to tell you why I do not recommend that. I don't see that as risk because we're learning topical estrogen delivery is much safer. The oral delivery, which means taking it by mouth in a pill, has been directly linked to increased cardiometabolic risk and also clotting. But here's some things about oral estrogen probably nobody has really ever told you before. Oral estrogen, when you take it by mouth, the first place it has to go to your liver. And when it goes to your liver changes it and does other things to it that can cause problems. Topical estrogen goes from your skin directly into circulation and gets distributed throughout your body and avoids the liver. Because when we run a lot of estrogen through our liver, here are some of the things that can happen because of that. And this is why I don't necessarily recommend oral estrogen. Things like increased blood pressure. It can affect your cholesterol adversely. It actually can increase liver enzymes. It can actually lower your growth hormone. It can increase the risk of clotting. It can increase an inflammation marker called hsCRP. And I've even had it cause an increased risk of carbohydrate cravings. That's enough things to tell me we really should be doing topical estrogen over oral to help prevent these issues when we know the estrogen topical route is much safer. And to be honest with you, it's that oral estrogen that was given back in the days, which triggered a lot of the fear about estrogen because that's what the data shows. It increases the risk of clotting and potential cardiovascular effects with the oral route. So that's why I just say maybe we should just avoid that at all costs. And as mentioned, low-dose vaginal estradiol or estriol can be given to help with those genitourinary or vaginal symptoms that can commonly happen during menopause. And keep in mind, these minimize that systemic, that means overall effects. It stays more locally in the vaginal area to help with these issues and really are much safer in terms of preventing cardiovascular risk and also that increased risk of other conditions that have been associated with estrogen. And if you're on estrogen, I've always been a fan and I've always been taught if your progesterone levels are low, you need both. And that goes for every time. And that is progesterone and not progestins, bioidentical progesterone. Because I've always been taught estrogen needs progesterone to work and progesterone needs estrogen to work. So this is so important that if you're on estrogen and if you also are low in progesterone, you need the two together to get the optimal benefit from hormone replacement. And the recommendation has always been start low, go slow, pick the right dose for you, assess symptoms, assess the labs, and make changes. Because hormone replacement is personalized. It is 100% the most important personalized thing that I see as a pharmacist all the time. And keep in mind, when you start it, it's up to you when you want to end it. There's nothing that says, oh, I've got to stop in 5 years or 10 years. If hormone replacement is still providing you the benefit that you started on, I don't think as long as you're monitored properly, you need to stop it and you control that when that happens. Now, one thing I see commonly that gets messed with estrogen replacement, and that is monitoring metabolism. Because yes, you put these estrogen in your body. Yes, they're bioidentical. And yes, you're doing the right dose, but you got to make sure the body's breaking them down and getting rid of them properly. And your body has three main metabolites. But through this process, these three metabolites go to the liver, and then they have to be changed so that your body can excrete them. And there's a 2-hydroxy, a 4-hydroxy, and a 16-hydroxy metabolite. And the really only way to monitor these is by doing urinary metabolite testing. So if you're on estrogen replacement and your doctor's not doing that, you need to be asking for this. So this first part occurs in the liver, and we really want to be looking to have adequate amounts of that 2-hydroxy metabolite because that 4 and 16-hydroxy metabolite can actually increase our risk of other diseases and actually potentially increase our risk of breast cancers. And that's not to scare you because if you monitor this, you can do things to control which pathway your body takes these down. But it's not checking is where the problem can actually come in. So we want to make sure the liver's breaking them down properly. That's the first part of metabolism. But the second part is making sure you eliminate these metabolites. And that's all about going poop. Your body excretes them in the feces, and that's how you get rid of them. So if you're not going poop every day and you're on estrogen replacement, you've got a problem. And that's critical to work with the provider to make sure that that happens so that you have proper breakdown of estrogen and elimination to keep yourself healthy while on estrogen replacement. So in terms of monitoring symptoms and your levels, yes, you should be checking your hormone levels, not just looking at symptoms. It's like trying to drive a car, but not see out the front windshield. So that's super important. But other things you can monitor, as we talked about the benefits of estrogen, are looking at your lipid panel. Make sure that improves. Make sure your fasting insulin improves. Check your liver function. Watch your blood pressure. Check in your bones to make sure they stay healthy and maintain healthy while you're doing hormone replacement is critical. But it's looking at this and tracking all these things before hormone replacement and after to make sure you're being dosed properly and getting the benefit. So now the rapid fire questions, I'm going to do a lot quickly because I get asked these all the time, but I think this will clarify so many things for you so you know the truth about estrogen. First, is hormone replacement or estrogen safe? And that's all about the timing, the dose, and the personal factors related to you. If hormone replacement's done right, especially estrogen, topical, and you're monitored properly and you control the risk and you look at metabolism, yes, I think the data now says bioidentical natural hormone replacement with estrogen is the way to go if your levels are low. Does estrogen replacement cause cancer? And I think this is not a one-size-fits-all question. It's very personalized and very much about that patient. Because yes, estrogen, if done wrong, could increase risk. To me, estrogen done right is a minimal risk, but even more importantly, it's all the lifestyle things that you do that actually have a bigger driver about cancer, especially breast cancer. And that's why I want to say it's not just estrogen replacement. It's a healthy lifestyle, diet, exercise, reducing stress, better sleep, making sure you have adequate vitamins and nutrients on board. And that combination is what sets you up to reduce your risk of cancer while on hormone replacement. Does estrogen cause blood clots and strokes? And the answer to that is one, oral estrogen. Yeah, I think there's enough data out there to say that you probably shouldn't be on that. But transdermal estrogen actually decreases these risks. And that's why the form and the type of estrogen you do is so importantly critical. Should I start estrogen early or should I wait? I think the data on that says you are definitely more favorable. You get better outcomes when you start estrogen earlier when you need it. I do see some doctors nowadays when ladies are in this perimenopause stage and they're still making estrogen and they're still cycling, adding estrogen then. And I'm a little worried about that because I don't think that's the time. It's after that period is over and you're in those menopausal years, early on is when important time to start estrogen. You can wait, yes, but you may not get as much benefit. And the other question sometimes I get is it too late to start? I'm going to say no, because I've done told you all the benefits that estrogen brings. Yes, you may need to do lower doses. We may need to monitor, but I don't think it's that impossible to say you can start estrogen at any time if you're low. Does estrogen help with hot flashes and night sweats? And I think, yes, estrogen can be one of those drivers, especially if you're low, because it does control vasomotor symptoms. But I do want you to know there are many other things, other hormones, stress, cortisol, diet that also can affect hot flashes and night sweats. So keep that in mind. Estrogen can be one component, but not the only component. How fast does estrogen work? Well, I'm going to tell you in terms of like those vasomotor symptoms, hot flashes, things. Usually within a couple of weeks, things will start to get better. If you really want to look at things like sleep or mood or brain fog, we're talking, 1 to 3 months. Remember, estrogen cuts on and cuts off receptors, and this takes time, but you will get effects. If you're looking for things like bone changes, vascular health changes, this takes months. So that's why being on it consistently, doing it every day, not skipping your doses and doing the way your doctor prescribes is so critical. But in terms of the overall effects, it will vary from woman to woman. But that's what's important to understand, especially for those long-term overall health benefits. It takes time of taking it to see those. Does estrogen help with brain fog? And I can tell you, I see this all the time. When I think about estrogen in women, I think brain, and I have seen ladies do much better, especially when levels are low, to help with that brain to be better functioning and better focus. Word recall and all those type things tend to get better, especially in a lady who has low or little to no estrogen. What about vaginal dryness, painful sex, and UTIs? I can tell you estrogen is the miracle worker here. And I can tell you if your estrogen levels are low, that vaginal tissue is the first thing to scream, hey, I need estrogen, by having painful intercourse, dryness, burning, and those type things. Replacing estrogen is critical. It's key. And if you're not going to do anything else in terms of estrogen replacement, it may be the one thing you want to do to help maintain and keep that vaginal area safe and healthy. Which form of estrogen is best? I'm going to tell you, I prefer topical, transdermal. That's gels, creams, and patches. I am not for oral. I've done told you why. I get asked a lot about pellets, and I think if that's the only way you can do estrogen, that's fine. But I will just tell you, I'm not the biggest fan of pellets because I see variations in terms of being overdosed early, right in the middle, and then low at the end. And to me, that doesn't match what the body did. We need to be consistent with a typical daily dose as far as that goes. So my preference, once again, is transdermal estrogen. There are some ability to do some injectable estrogen shots that you can do. Once again, this is bioidentical estrogen, but my preference is topical. If you're on estrogen, do I need progesterone for my uterus? And that is yes. If you have a uterus, it's those balance of two that keep that uterine lining in check. One is like the fertilizer to make it grow, and one is like the lawnmower to cut it. And we have to have a natural balance of those two to keep things balanced. I do want to stress this isn't a progesterone podcast, and I have one of those, but just so you know, just because you don't have a uterus, you still need progesterone to allow that estrogen to work properly, and don't let anybody else tell you otherwise. Is bioidentical better or safer? I'm going to tell you bioidentical is a must. If you're not replacing the hormones that your body made, these are synthetic, kind of like hormones your body made, run, stay away. You need to be replacing estradiol and you need to be replacing estriol, and that's the way to go. We don't typically replace estrone, which is the other estrogen the body makes, because it's more inflammatory. There's some thoughts it may have some negative health consequences, but unless if you're doing hormone replacement with estrogen and it's not estradiol or estriol, I wouldn't replace it. Can estrogen make me gain weight? I get this one all the time. So I'm going to say estrogen decline is directly related to that central fat gain and insulin resistance. So estrogen done right, in the right form, in the right dose should actually help you control weight, not add to it. So if you're starting estrogen and you start to gain weight or other hormones, you're not on the right form. It's not dosed properly, and don't take it, well, that's just part of hormones, because I can tell you hormones done right make you more metabolically fit and actually improve your ability to keep your weight in check, not add pounds to you. Does HRT prevent osteoporosis? And estrogen is probably one of the most important things you can do in terms of reducing bone loss and fractures. And once again, you take estrogen, give it the right building blocks, vitamin D, all your minerals that are needed, and added resistance training, you've got the magic bullet that's better than any prescription drug that I can give you to build your bones. And finally, how do I find a provider that understands hormone replacement and menopause? And I will tell you, this is the most challenging. One thing I would say, if you live in Magnolia, Texas, hey, we could help you find one. But if you're anywhere else in the country, what I recommend is find a good, locally trusted compounding pharmacy in your area. Ask for the pharmacist and ask them who in your area does hormones right. Because it's one thing to replace hormones, but hormones replaced right are a game changer. And it's hard to find those prescribers that are trained properly to help you with hormones. But that's the way I would recommend to find somebody that you can trust that can do the hormones the right way. Estrogen is one of the most powerful signals that your body uses to keep your brain, your bones, your mood, metabolism, and intimacy working together. What I love is the conversation around estrogen is finally changing. Women are asking better questions, getting better information, and realizing they don't have to suffer in silence any longer. If your estrogen changes have made you feel unfamiliar, even in your own body, you're not alone. I see this all the time, but the key is education and understanding. Because when you understand how hormones work, change your body, and what they do, you become your own advocate. And you become a better success story in terms of keeping yourself healthier and happier as you age. I hope you found this episode enlightening, and if so, please like it. But if you know someone who's been suffering and you've heard the same story, I don't feel the same in my own body, make sure you share this episode with them, because sometimes understanding all this is the first step to finding success. And in your journey, always keep searching the truth about how the body works.